Unique Digital Health ID explained in this video. I'm Arun Singh. Let's get started. The newly launched Ayushman Bharat Digital Mission will involve a unique health ID for every citizen. But what is a unique health ID and how does one get it? Well, if a person wants to be part of the Ayushman Bharat Digital Mission, which is ABDM, he or she must create a health ID, which is a randomly generated 14-digit number. The ID will be broadly used for three purposes: unique identification, authentication, and threading of the beneficiary's health records, only with their informed consent across multiple systems and stakeholders. The key components of PMDHM include a health ID, which is a unique 14-digit health identification number for every citizen that will also work as their health account. Currently, over 1 lakh unique health IDs have been created under the National Digital Health Mission. The National Health ID will be a repository of all health-related information of a person. The Health ID will enable access and exchange of longitudinal health records of citizens with their consent. This health account will contain details of every test, every disease, the doctors visited, the medicines taken, and the diagnosis. This information will be very useful as it is portable and easily accessible even if the patient shifts to a new place and visits a new doctor. The health ID is created by using a person's basic details and mobile number or Aadhaar number. Personal health records can be linked and viewed with the help of a mobile application. Health ID under NDHM is free of cost and voluntary. Now, what are the possible benefits of a digital health ID? Well, data portability could expedite the treatment of the critically ill, especially those who suffer from more than one ailment. The severity of COVID-19 effects amongst those with comorbidities has highlighted the need for a repository that alerts a doctor to a patient's medical history at the click of a computer mouse. In the long run, the creation of a health record system could improve public health monitoring and advance evidence-based policy making. Now, what have been the concerns of a digital health ID?
The digital healthcare sector received a huge boost to the pandemic as lakhs of Indians access healthcare services to digital healthcare apps. Now, this is a positive development. However, there are clouds on the horizon. Given how loosely regulated the digital healthcare sector currently is, it's likely that in the coming months and years, we'll see many more instances of health data fraud and maybe even exclusion from public health services.
Data by the Telecom Regulatory Authority of India indicates that the rural-urban disparities continue to prevail, as indicated by the rural internet penetration rate of 35%, which is not even one-third of the urban internet penetration rate of 104%. In such a scenario, it is likely that many Indian citizens will not be able to adequately navigate the digital health ecosystem and may end up being excluded from the Ayushman Bharat Digital Mission environment.